Hi everyone, my name is Jishi and today I'm going to be presenting about low-income families with children in rural Maine. Overweight and obesity are the excessive accumulation of fat and weight in an individual's body, which puts them at an increased risk to develop problems like diabetes, cardiovascular diseases, and cancers. Consuming a healthy diet is essential to help lower the risk of high cholesterol, high blood pressure, heart disease, stroke, diabetes, cancer, and becoming overweight or obese. Maine is ranked as the 28th in the nation for adult obesity rate and 29th for the highest obesity rate among youth aged 10 to 17. Research shows that adults in Maine who were in lower income groups with less education were more likely to eat less than one serving of fruits or vegetables a day than their counterparts who had higher income and a better level of education. According to Northern Light Health, Maine 2020 has set objectives related to physical activity, nutrition, and weight, focusing on enhancing physical health of children and their household status. 19.6% of children between the ages of 6 to 11 and 18.1% of youth between the ages of 12 to 19 in the United States are obese, with obesity being more prevalent among the population in rural parts of the United States than urban areas. So basically, children with low income in rural areas were more likely to be overweight or obese. I really like this image because it clearly depicts the reality of the topic at hand. A survey conducted in 2007 among parents of children in Maine who were enrolled in Medicaid insurance program showed that 27% of the children between the ages of 2 to 18 were overweight, as opposed to 16% of children in other parts of Maine, and the disparity in income is the reason why there is this difference in obesity rates between those families with low income as opposed to their counterparts who have higher incomes. Families in Maine need on average an income approximately twice the federal poverty threshold to meet their basic needs, and at the same time, children living in low-income families unfortunately constitute 41% of the population, which is quite a high number. Studies in urban areas have shown that low-income neighborhoods with poor food environments have higher rates of obesity, and urban areas are commonly considered as food deserts, which are basically areas with poor access to healthy and affordable food. This image clearly depicts what a food desert is. This individual with a sign that says next grocery store is 15 kilometers is basically how individuals need to cross long distances in order to attain healthy food. Regarding obesity determinants on the individual level, we have economic status, eating behaviors, and physical activity behaviors. Regarding eating behaviors, healthy eating is associated with a lower risk of cardiac diseases, stroke, and cancer. And studies show that children in the United States are not consuming the recommended dietary guidelines for the different food groups that include fruits, vegetables, and fats, which affects their health overall. And possible intervention to increase the consumption of such foods would be to make them more readily available in schools, because children spend most of their time at school, so starting there would be a great idea. Regarding physical activity behaviors, regular physical activity improves overall health and reduces the risk of developing health problems. In order to help children engage in more physical activity, a possible intervention would be programs that are not only executed at the school level, but also at neighborhood levels that call kids to engage in more outdoor activities in order to become more physically active and spend less time in their homes, on the television, or their tablets. Evidence from research shows that children between ages 6 to 11 experienced a lower risk of overweight and obesity because of engaging in physical activity. Another cross-sectional study aimed at comparing physical activity levels of overweight and non-overweight children aged 3 to 5, and the results found that boys who were significantly less active than their non-overweight classmates were at a higher risk of becoming overweight or obese. Regarding obesity determinants on the interpersonal level, there are family health behaviors, home food environment, and extracurricular activities. Environment created at home plays a big role in the behaviors that kids acquires regarding their attitude towards food. The parents' behavior towards food truly affects their kids' behavior towards food. A possible intervention would be to raise awareness among parents in schools by holding seminars and educating the parents about the importance of having a positive attitude towards food, and possibly engaging in cooking with their kids, buying healthy products, healthy ingredients that they can prepare with their kids at home to make them more interested in eating healthy. A cross-sectional study investigated the relationship between body mass index and fat mass with children who participated in extracurricular activities, and results showed that children had lower BMI and fat mass when they engaged in physical activities. Regarding the community, on a community level, an obesity determinant is an obesogenic environment, which is basically the influences of surroundings, opportunities, and conditions that play a role in promoting obesity among individuals and population groups. Whether or not an environment is obesogenic is dependent on the proximity of neighborhoods to parks, pedestrian sidewalks, recreational facilities, and safety. Neighborhoods with more fast food outlets and restaurants had higher rates of overweight and obesity as opposed to neighborhoods who had lower fast food outlets, because the neighborhoods with more fast food chain restaurants made it more readily available for individuals to consume such foods as opposed to if they were not available in the first place. Potential interventions would be implementing policies to help healthy food choices become more readily available to individuals. In 2014, the USDA Food and Nutrition Service suggested regulations for school wellness policies, including setting specific goals for physical activities and nutrition and education promotion. Improving school food policies and the foods available for students strongly helps in promoting health and reducing obesity incidence. A school nutrition policy to raise awareness and extend parent outreach is essential, because starting with parents truly affects parents' attitude towards food and which consequently basically affects their kids' attitude towards food. So it would be a great idea to start with the parents and move on to the kids and work with both groups as a whole in order to achieve the desired outcomes of the intervention that is planned for this specific population group. A study implemented a school nutrition policy implemented a school nutrition policy, including school self-assessment, nutrition education, nutrition policy, social marketing, and parent outreach, showed a 50% reduction in the prevalence of overweight and obesity among children in the intervention group. This shows the importance of the intervention at a school level, starting with both parents and kids through awareness, educational programs, pamphlets that the kids can take back home, as well as activities which kids and parents can engage together, such as fun day at schools where the parents are invited to engage in physical activities with their kids, as well as healthy eating seminars with which both of them can attend. Definitely, an intervention takes time and it needs a lot of research, and obviously it should be executed in an efficient way in order for it to be effective. But I believe that starting with schools and, like I mentioned, with families as a whole would be a great first step. Thank you for listening to my presentation, and I hope you enjoyed it. Those are my references, and I'm looking forward to hear your feedback. Thank you.